Um, Thank y'all so much for coming. Welcome. We are super excited to have y'all here for the Justice Education Series hosted by the PD Green Program. In our audience today, I know we have some longtime friends and volunteers of the PD Green Program, along with some new faces. I also know that we have a watch party going on right now at Tufts University, so shout out to that group. And I think we're in for a really great conversation. First, let me introduce myself. I'm Siobhan Cook. I'm the Volunteer Engagement and Organizational Learning Manager here at the PD Green Program. As many of you already know, the PD Green Program is the largest multi-state provider of tutoring and college readiness programs in carceral spaces. We provide educational support and workforce development to currently and formerly incarcerated folks in a variety of settings. And the work that we do to support those educational and professional journeys is really the core purpose of our organization. But in addition to the work that we do in facilities, we're also committed to providing our volunteers and the wider community with the resources needed to understand the impacts the carceral system has on individuals as well as communities. And one way that we accomplish that goal is through programming like tonight's webinar. Just so everyone knows, the way that this Zoom webinar is set up is that we can't see or hear y'all, but you should be able to use the chat and Q&A features. The plan is to spend some time getting to know the work that our panelists are doing around food justice, and then we'll turn to audience questions. I'm going to try and leave plenty of time for those, but don't feel like you need to wait until the end to submit those questions. Feel free to send those in at any time, and then we'll kind of look at those here in a bit. As I've mentioned, the PD Green program is about educational support, and we help people learn. But we know that hungry folks can't learn. There's physiological and psychological impacts to being hungry, to worrying about where your next meal is coming from, to not having the right nutrients. And people quite literally can't take in and retain information in that state. And there are also major health implications, both in the short term and in the long term, related to food. But food isn't simply about survival. While we do need to eat in order to survive, there's also a cultural component. So food injustice, both in and outside of prisons, is wrapped up in all of these areas. And so while we're definitely talking about nutrition and health, we're also talking about humanity and dignity. So with that, I'm going to go ahead and introduce our two panelists tonight who will be sharing their insights on all of that and more. And to start off, we have Heile Gantan, who is a program manager with the Food in Prison Project. Her background in nutrition, public policy, and lived experience with the California Department of Corrections and Rehabilitation motivates her work to improve the food environment within jails and prisons. She works closely with other nonprofit, civic, and state organizations in her advocacy efforts to support those impacted by the criminal justice system. And we also have Daniel Rosen, who is a justice reform advocate and writer who was incarcerated in both Virginia and Washington, D.C. from 2015 to 2021. Before co-founding the Coalition for Carceral Nutrition, he was an advocate with Worth Rises, a nonprofit working to dismantle the prison industry and end exploitation of those it affects. Prior to incarceration, Daniel spent almost 20 years in public service in both the nonprofit and governmental sectors. He's been recognized throughout his career for successful management of programs, people, and funds to serve the public trust. Daniel holds a master's degree from Tufts University and a BA with honors from UCLA. He resides in Washington, D.C. So thank you both so much for being here. If you could, as a way to kind of kick us off in this conversation, tell us a little bit about how you got involved in this work and a bit about the organization that you work with. And let's start with you, Heile.
Yeah, thanks so much. And thanks so much for having me. So again, I have a background in nutrition and food. It was actually during my time trying to complete my degree, I did have to fulfill my legal obligations. And so I had to put my academic training on pause. But having that experience, going to school, learning about really the messaging of public health and how to eat healthfully and nutritiously here in the public sense, it was very conflicting when I did spend time incarcerated, seeing the kind of foods that were being fed to us seeing the manner in which food was being delivered to us, that was also like a very stark contrast to many of the things that I learned inside of the classroom. And so that created just an even deeper interest, and really it turned into a passion to identify the issues that are inside of carceral settings as it relates to the food and the food environment, but then also to seek solutions as someone who is now on the inside and has that very close intel with, you know, everything that was going on at the different facilities that I was incarcerated in. You know, 5 years after that, I was sentenced to 5 years here in California. It was still my mission to complete my degree in food and nutrition, especially with everything that I've learned and experienced, which I was gratefully able to do so in the 2 years after reentry. But that wasn't enough, right? I was very limited because now I had a background, and unfortunately there were barriers to employment. But for me, there was something that was calling me to do more at the top level. So really looking at policy, right? A lot of these institutions and agencies, they comply mainly by policy. And so I thought, okay, public policy is going to be the route for that. In my graduate program, I had an internship requirement, and through that internship requirement, I found Impact Justice, which is the organization that I work for now. And as frustrated as I was because of, you know, the lack of conversation that we were having around food and nutrition inside of these carceral spaces, it was Impact Justice that released a report in 2020 that led the first ever national investigation of food inside of prisons and jails. And in that moment, I was sitting in a webinar similarly to this one here, where I was just like, oh my gosh, someone knows the struggle. Someone actually took the time to research it in a way that felt not just true to my experience, but authentic to the experience of incarcerated people. And that really led me to finding a way to just support the Food in Prison project. I remember reaching out to the lead author, Leslie Sobel, who is now my boss. And I was just like, how can I just get involved? Like, I just want to be a part of this conversation. And so that's eventually what led me to the work here at Impact Justice. And overall, Impact Justice is a national nonprofit that looks at different solutions-based and research-based ideas and programs that help to support folks who are impacted by the carceral system, both for those who are currently incarcerated and also formerly incarcerated, but also in addition to that is like pre-contact with the system.
Thank you so much. I'll be dropping in the chat links to both of these organizations, but Daniel, could you go ahead and tell us a little bit about kind of how you got here and the work that you're doing?
Yeah, and first, thanks to Petey Green for doing this and for highlighting this issue as part of your Going Green series and this whole set of events. I'm appreciative of the work Petey Green does in general, but I think highlighting this issue is definitely one that's the focus of a lot of my work, and appreciate that. And also some appreciation for my jumbos out there. As a former student at Tufts, appreciate all of you tuning in from up there in Somerville. Yeah, and Heile's a good friend, and Impact Justice certainly has been at the forefront of this work for the last 5-6 years. I think especially doing a lot of groundbreaking work around this issue and what it looks like in prisons and jails across the country. I came home about 4 years ago. But before that, let me back up. Back about 15 years ago, I had a pretty serious health scare. One that kind of forced me to start paying more attention to not just my health, but how nutrition affected my health. And changed really the way I was eating and the way I was thinking about health and nutrition, the relationship between those things. And then about a year or two after that, I was incarcerated. And as anybody who's been inside can tell you, it's a very difficult thing to protect your health and eat in ways that really support your health inside. And I spent those 6 years as I've said, kind of begging, borrowing, stealing anything I could that looked like healthy food. And when I came home, I found some like-minded folks, really just as an advocate and a returning citizen here in D.C. One of the organizations that I had been kind of working with on reentry was involved in this issue, and I just started testifying about this issue, learning about this issue. I think one of the things when I came home was understanding the ways in which my experience during those 6 years was typical or not to other folks' experience of incarceration across the country. I think it's one of the difficult things is it's very hard to generalize about incarceration or carceral conditions. When you talk about jails and prisons across this country, you're talking about thousands and thousands of different facilities. And they don't all look the same. People's experiences vary pretty widely. When it comes to food, we know it's generally pretty bad. No one gets a real good grade, but those experiences are real different in different settings. So I came home, started working on this, and as you said, was working on some other issues around kind of prison industry, around different aspects of incarceration. And a colleague of mine in New York and I really just decided a year or two ago that there was room for more work in this field, that there was more that needed to be done, that the work that Impact Justice had started was really needed more amplification, needed more folks working in this space. And so we started this nonprofit to just really see what else we could do that to highlight this issue, to affect kind of public narratives around this issue, public education around this issue, and to kind of build a coalition of stakeholders in this space to start seeing if we could work with any jails and prisons that were interested in working to change the way they're doing business, and also then to start working here in DC, trying to change how the jail here, DC's Department of Corrections is really a large urban jail, and to change how they're doing business around food and nutrition here in Washington. So I'll leave it there.
Yeah, thank you all so much. And again, I've got links to both of these organizations. I'll also be dropping some other resources here as we continue. But I guess I want to back up. The volunteers with the PD Green program do go inside facilities and reentry spaces and are doing work in the education wings often. But we don't, as people on the outside, often get to see what meals and food is really like on the inside. There's a lot of purposeful, like, keeping of that information from the public. So I was hoping that I could get y'all to talk a little bit about both like with y'all's own experience, but also as you've been working on this issue over the last few years, what you're seeing, like describe what food is like on the inside in terms of like, what kinds of meals are common? What's the nutritional makeup of that? Are people getting enough to eat? All of those kinds of components so we can really kind of picture what y'all are talking about here.
Yeah, I can start. Lots of times the trays are very carb heavy. Little options for fresh fruits and vegetables. And oftentimes you see a lot of commodity foods. You see a lot of these hot cereals. You see a lot of beans in rotation throughout the week. And oftentimes many of the meals are unrecognizable. So you don't really know what it is you're eating. The menu might say one thing, but you're not sure if it's a goulash or an Alfredo, or maybe it's a soup. And that goes a lot. I think my opinion is because of the cooking processes that are, every kind of bean that are employed inside of these large institutions. We were just on a call, Daniel and I were just on a call earlier, and we were talking about the cook chill method, right? Where there's a repetition of cooking and heating and reheating. And once it gets to the end user, the end consumer, you're not sure what it is or how many times it's been reheated or even know what the nutritional value is anymore at that point, right? So there's a lot of distrust when it comes to the food system inside of carceral settings as an incarcerated person. You know, things are slopped over. I think what Hollywood does do a good job of is really showing the kind of food that exists, you know, whether it's a cafeteria setting or a prison or jail setting, it looks the same. There is a lack of care when things are slopped onto the trays, right? There are these like sections where sometimes they're like extremely underfilled, and you have, you know, the frustrated person in line saying like, hey, what about this person, or what about this portion? And you're just redirected elsewhere. You know, many of those things happen inside of carceral settings because once you get your issue, really that's it. There are no opportunities or very little opportunities to advocate for yourself or for your correct portion. And many times what staff does is they just redirect you to the grievance process, right? Or just look at the policy and take it up with someone else because it's above their pay grade. So there really is this lack of interest for supporting incarcerated folks a lot of times when it comes to the food. And also it comes down to attitudes, right? Like we encounter some folks who are really eager to try and improve the food system. Unfortunately, we still get some folks who are like, well, this is prison and this is what they're going to get, right? But everyone who is in prison is still a person in prison. And that's where a lot of the work that I do, you know, I'm motivated to restore folks' sense of human dignity in these kinds of like dark, lonely spaces through food. Because food can be a way to unify folks. It can be a way to show hope and joy for folks, even in these like dark times. But, you know, I think with some of the work that, you know, we're doing at Impact Justice and that Daniel is also doing, we're on our way to getting there. I think like it's those little incremental steps. But as of now, we still see those like really horrible conditions in many institutions.
Yeah, I think Heile did a good job explaining what's, you know, what a tray looks like. I mean, we have used the phrase change the tray as kind of our goal, as a slogan. Because I'm interested in changing policies and I'm interested in changing menus and I'm interested in changing perceptions and attitudes. But at the end of the day, we got to change what shows up on trays for people. I think, you know, I've said this a lot, but 3 times a day, the state, the county, wherever you're incarcerated, tells you exactly what they think of you when they hand you a tray. And in the same ways, I think that kind of in the reverse, you know, when we share food with each other here in the free world, when we make food for our family, when our parents cook for us, when we show each other kind of care and love through food. And by, you know, by taking our time to prepare it, by making it nice for somebody. And the opposite really is what you get inside. We show people that we really don't care about them as people the way we feed people inside. I think you know, it does tend to be unhealthy in all the ways that we already know institutional food service can be unhealthy around the lack of nutrient-dense foods, a lot of empty, starchy calories, a lot of processed, ultra-processed foods, mystery meats, and things like that. And people have little choice. We Let me kind of take a different also tack. We did a pretty interesting survey a couple years ago in the DC jail. And we got a pretty good response, right? About a quarter of the people responded. I mean, people care about food. The way everybody tends to care what they eat day to day, people care about food. They're going to answer surveys about this. The bigger surprise was that they let us do this survey, I think. It's also hard to just get primary data from folks inside sometimes. And I think, you know, the conclusions didn't surprise us, but firsthand evidence is valuable. And I think, you know, what I took away from that and what we took away from the data was just these 5 things. 1, the food is unsafe. An overwhelming number of people are served food that's spoiled or rotten. Bread, milk, fruit when it shows up, or vegetables. 3 out of 4 people basically say they've been served food that's spoiled or rotten. And that's a pretty damning number. A lot of food too, a lot of food's being wasted. A lot of folks just don't eat what's put on the trays because it's unpalatable, it's inedible. And that leaves them probably turning to what's known as like commissary or canteen in a lot of places, if they have the funds available, if their family can afford to support them that way, to buy a different kind of unhealthy food, processed packaged foods that are shelf stable, that are available to them. 12 different kinds of cookies, cakes, chips, almost no healthy food. 3, a lot of people inside are hungry related to that because they just don't have the money, and the food that they're being served in the chow hall is not edible. You might go to the chow hall and just to see what's there, because there's one thing on that tray that you might want to take back to the housing unit and save for later. 4 people self-reported that they get almost no fresh food. I mean, I know all these things, having spent about a year in the DC jail, so I knew what this would say, but they get almost no fresh food. Almost no fresh fruit, sometimes vegetables that are kind of cooked to death, cooked all the nutrients out of them, but almost no fresh food. And 5, I mean, self-reporting from their aspect that it was damaging their health, both their physical health and their mental health. Overwhelming numbers of people said those 5 things. 7 out of 10, 8 out of 10, 9 out of 10 people said those 5 things about the food there. And I think it's just, this is not a debate. Food in jails and prisons is harming people in all the ways that we know unhealthy food has effects on people's health, has effects on people's sense of themselves, their sense of agency, their sense of dignity. And some of this is about what they're fed. Some of this is about how they're fed. I don't think people realize that breakfast in jail or prison might be as early as 4 a.m., middle of the night, woken up. That dinner might be as early as 3:30 in the afternoon, so that you're hungry again by the time 9 or 10 o'clock rolls around at night. I don't think people realize the amount of money involved in prison food service. I don't think people realize there's this, everybody understands if you're in jail or prison that if it wasn't served to you on a tray or you didn't buy it off commissary, it's contraband. And we have turned fresh food into contraband in prisons and jails. If I took an apple back to my cell from the chow hall, absolutely I could be written a ticket for it. Absolutely I could be sent to the hole for it if somebody wanted to. I got a ticket once for having hidden a boiled egg in my cell in the Fairfax County Jail during a 5 a.m. shakedown after breakfast. And I'd hidden it because I wanted to eat it later, because I knew I'd be hungry later. Those kinds of things happen all the time. And people make a habit, and they make a business out of smuggling food around to eat, to sell. But when we're turning quality or fresh food into contraband, there's something deeply wrong with the food system. And I'll leave it right there.
Yeah,
There's a lot to say about this. I think we could spend the whole hour and a half on this question of, combating some myths or misconceptions or ideas that people have about, this idea that people are food secure in jail or prison doesn't really exist. We have this popular notion. I think the one thing, Heile, that I might mention about like Hollywood or popular conceptions of jail or prison food is this idea that you get 3 hots and a cot when you go to jail or prison, and that therefore people are food secure. There's really, maybe somewhere that exists. Maybe there's some jail somewhere where people get 3 hot meals a day and they feel full. And um, I certainly didn't experience it, and nobody I've ever spoken to about this issue has ever experienced anything like that. Generally, you're wondering where your next meal's, whether it's going to be edible, what's going to be on those trays, what you're going to have to go in your box, in your commissary box, and cook instead, because the answer is usually no. And I think people don't realize the extent to which jails and prisons are really sort of food deserts, and how little actually, I think there are some people who they may not be approaching it from the standpoint of dignity or agency. But the issue of, the economics of this issue makes sense, or the economics of this issue they realize don't make sense. That we are spending untold billions of dollars in this country, so that people can throw food in the trash because it's inedible in the first place. And then cost families. The average family spends something like $4,000 a year, I think, supporting loved ones who are incarcerated. And a lot of that's commissary, some of it's phone calls, but a lot of that's commissary. And these profiteering food service companies keep finding new ways to make money off of prison food service. Not every jail or prison outsources food service. A healthy number of them do. But even the ones that don't, they have programs like where your family can pay for meals during visitation, so that you can go and sit and have junk food with your family during visitation, if they even allow visitation anymore. A lot of places have moved to video visits, or the vending machines involved, or there are new ways to extract money around this issue all the time from food service companies, and there's only a few big players in that regard. I saw a question come up in the chat already about that. I think what folks need to realize is a good amount of this is privatized, but a lot of prisons and jails don't privatize food service. They just do it badly themselves. They're doing fine doing it badly on their own. They don't need a private company.
Yeah, I want us to talk a bit more about both of y'all's organizations, but while we're kind of looking at the questions coming in the chat, because I do think that there's a lot of questions about like, why is this the state of food in prisons? There's a question in the Q&A, and I think y'all have already kind of alluded to this, but is it an issue of money? Like, is that the driver of poor quality, or is it something else?
Heile, do you want to
Oh,
take that first?
sure. When we speak with folks at DOCs, it's always the budget. That's the first line of defense whenever we ask them, why? Why is this the quality of food that we're putting out? Why, is this the variety or lack of variety of options that we're giving the incarcerated population? And yeah, it comes down to budget. However, we have met some champions on the inside who, despite that same budget that all of the other institutions have, they have been able to go above and beyond and create some really interesting meals. I mean, still within limitations, still within, the written menu and the guidelines. But for example, we have one site who is implementing our Harvest of the Month program, and they were talking about how they've included fresh broccoli into their smoked cheese chowder so that the incarcerated population can enjoy something new, something fresh. And when we asked, how were you able to buy such good quality cheese? This food manager in particular was really happy to share about, how much he keeps track of like opportunity buys through local vendors and just like really keeping an eye out for sales and things that would fit the budget, and also just adjusting, right? Like forecasting into the rest of the fiscal year, seeing how he can maybe reduce some costs elsewhere, or even making small tweaks to the menus that are being set, knowing the preferences of the population that he's serving. I do think that there's a lot of opportunity for some creativity even within the budget. I think that there's also opportunity for advocacy, right? Like if we're a lot more specific about how we want those funds to be used. An example of this is here in California, there was some advocacy around local funds for the Department of Corrections so that they can purchase locally grown fruits and vegetables to be served to the population. So I think that there are some multi-pronged approaches that can be done, considering that, the budget is always going to be a big issue and a big hurdle to get over.
Yeah, and I think there's, I don't know what any of the 90 folks on this call, on this webinar would say if we asked you to guess what prisons and jails are spending to feed people, but the numbers around, I mean, it's pretty hard to average this. There's a wide variety. The typical number that's thrown around is about $3 a day, about $1 per meal. In some places that looks far lower, in some places that looks a good bit higher. But I think the number I've seen is that the average American spends about $11 a day on food. About $20 a day if you include going out. So that's just on cooking at home on groceries. And that I'm sure is going up in the last couple of years. I think there was some recently, I saw a lot of stuff online about SNAP challenges and people eating on SNAP on $6 a day and how hard that was. It's very hard to feed people healthily at $3 a day. And the other thing about that is just how kind of the math on that's pretty bad. I mean, a lot of Virginia, I think 2022, the numbers were something like they spent about $25 million on food service and about $250 million a year on healthcare. So this idea that somehow food service budgets can be severed from the idea of healthcare, from wellness, from nutrition, from health it's kind of insane. We're spending far, far, far more on the back end. Healthcare costs are eating corrections agencies' budgets. It's second only to staffing for most corrections agencies. And it's often like 20, upwards of 20% of their budgets being spent on healthcare. And we know that a very large percentage of that is being spent managing chronic diet-related disease that they have fed them in the first place. So they are feeding people chronic disease, literally. That's costing taxpayers far, far more on the back end. I think one of the ways that we will know we've made progress on this issue is when food service costs are considered part of a larger health and nutrition and wellness budget. And when corrections agencies start to see that as one integrated whole in one whole picture, I think we'll have moved the needle a little bit. Because we won't be arguing about these pennies on the dollar that we're spending on food. It's foolish. It's counterproductive, actually.
Yeah, thank y'all for kind of providing that broad overview of what we could totally spend multiple hours talking about. I guess I want to turn now to some of y'all's organizations or the organizations that y'all work with. Recent efforts and projects. So could y'all talk a little bit about a specific project or initiative that you've been working on recently that kind of embodies your organization's vision and kind of where you're headed to address some of the many issues that have been raised already today? Heile, go for it.
Yeah, sure. And thank you for dropping the brief in the chat. I would like to share about our Harvest of the Month program that's happening here in California. We kind of started this webinar today, making the parallels with like students who are hungry. And so kind of like with that same energy, we wanted to bring Harvest of the Month to carceral facilities, right? It's hard enough to get folks to think of the incarcerated population without the same stigma that just comes with these kinds of conversations. But we figured that if we can make the argument that, look, they are experiencing the same kind of institutional issues when it comes to feeding, both in jails and prisons and in school settings, then a similar program like Harvest of the Month should also yield similar successful results. We've implemented Harvest of the Month here in California beginning in July of 2023, and we started at 3 facilities, and now we are at 27. So we've scaled out, bringing 3 facilities every quarter. And really what this program does is it helps to support local farmers by sourcing locally grown fruits and vegetables and bringing it into CDCR, which is the California Department of Corrections and Rehabilitation, and serve these fresh, healthier items to the incarcerated population. This is really the first of its kind that we know of here in the United States. We were really just like, it was an interesting way that we were able to even get into CDCR to listen to us and take this idea on. And it wasn't until we learned about this bill here in California, it's AB 778, that was passed in 2022 that requires state-run institutions to purchase a minimum of 60% of their agricultural products from California farmers. So for us, this was like our, hey, look, you've got to do this. And we're here with some solutions or, some suggestions on how to do so. How this really fits in line with the vision of the Food in Prison Project specifically is that, it supports added variety, increased nutrition, and nutrition education for the end consumer, right? I think a lot of times we're just wanting to improve the food as it is. We want to give them more. We want to provide them with all of these like great items. But I think that there's also a necessity for that nutrition education. We speak to a lot of folks who are currently and formerly incarcerated, who after being down for so long, either have never experienced certain types of fruits or vegetables or have forgotten certain types of fruits or vegetables. And so they're just, maybe unwilling to try new things. Especially if they see it on the tray, right? Like, as I mentioned earlier, there is this sort of distrust because of how opaque the system is on the inside. And so with our work, we are able to provide the participants, monthly materials that highlight that harvest of the month item. We talk about the nutritional benefits of that item. We talk about where it came from. We even show, like a little pin on the map so that they feel that connection to where they are with their prison site that they're currently housed in, and then also the farmers that are on the ground. And we also share information about the farmers and why things grow well in that area or the kind of farming practices that they use. And we do follow up with the folks who are there at the sites, and we ask them, hey, do you like this kind of stuff? Is this important to you? And just recently we spoke to some folks who said, these are the kinds of things that we like to tell our folks when we call home. They're usually nervous or scared to tell us about like the great things that they've eaten, but honestly, it feels like we're more connected to them through this kind of program, right? Like having a variety of avocado and strawberries, it brings them back to a time in their life where they felt normal. Even having a fresh lemon is something that you will almost never see inside of a prison or jail. But we talked to someone and he was just lit up with excitement, just recalling the kind of memories that he had when he sprinkled that lemon on his hot Cheetos that, yes, he got from Canteen. However, those feelings of connection, those feelings of like the memory of, oh, I remember just going down the street in East LA and hitting up a cart and sprinkling lemon over my hot Cheetos, like those feelings, those memories increase the morale on the yard, right? And if folks are feeling happier, if they're feeling better, if morale is high, there are these unintended consequences of these types of programs where, the behaviors of folks on the ground they're less likely to want to inflict violence or to maybe even have a bad day because they had a great meal, right? So I think that is really where our alignment with the Food in Prison Project comes in through this Harvest of the Month program. It's finding that connection, finding that normalcy, while also providing the added variety and then the nutrition and the connection to the local community too.
Thank you. That's amazing. Thank you so much for sharing. Daniel, what are y'all working on right now?
Yeah, as a young kind of startup, struggling NGO, looking of course, to raise money and get some work going. I think one of the things that's really, low barriers to entry is advocacy around this issue, and just working on the public narrative, publicly held perceptions around this issue. So writing, doing that advocacy, and trying to kind of raise the profile of this issue. And, we're in this, for better or worse, kind of this maha moment, right? Where the national politics and the national discourse is at least recognizing that there's some deep connections between food and health. And if there is an opportunity to extend that idea to how we're feeding the people in our care and carceral facilities, I think that's worth taking advantage of. We certainly have been working here in DC and I see a couple of questions in the chat that I kind of want to answer in answer to your question. I think people even who are knowledgeable about food and food systems are often surprised that there is not more by way of policy, regulation, any real structure around how people are fed in prisons and jails. 50 state departments of corrections kind of do this the way they want to, as long as it's in alignment with state law, as long as it's not in contradiction to state law. 3,500 roughly county jails feed people the way they want to. They feed people in a way that says, we're checking a box. We fed you today. And there's not a lot that tends to limit that. People have said to me, well, school lunch has a lot of regulations around it. School meals, school breakfast, school lunch. Really long list of like federal guidelines and regulations around school lunch. Doesn't exist in this space. It exists for school lunch because the federal government provides reimbursements around school lunches. And I don't see that ever happening, honestly, with meals in carceral facilities. So one of the things I think we recognize needs work in a lot of places is the policy, right? Legislative policy, legislation, policy, and administrative policies from corrections agencies. These things, assuming that there's some either interest at a legislative level or interest at an agency level, we're trying to work with those that want to work on this. And so in DC, we were able to get some legislative provisions passed around this that says, that told the Department of Corrections it was going to put in place some standards around how they feed people. And then now the fight really is to get that legislation funded. So legislation was passed, but not funded. No new funding was attached to it. And that, that is kind of work that needs to be done at the policy level in a lot of places, including DC, and we're continuing to work on that, as well as just building coalitions on a national level for sure on this issue, but really also on a state and local level. And in DC, we've been doing that for the last few years, together with Impact Justice and some other community organizations and partners that care about this issue. And that coalition building, I think, it's important. So the DC legislation, there were some provisions passed, but without funding, the Department of Corrections here, I think, has seen that as kind of an unfunded mandate. And we've been then, the next step for us was kind of working with them to say, okay, well, if there's no new money, what can you do within your existing funding to improve food and nutrition in the jail? And so that's been kind of a lot of the work of the past year or so, is trying to get them to, as they say, first, like, admit you have a problem. And the survey helped, right? The survey I mentioned earlier, there was, we created some publicity, and we created some pressure on the DOC around that. And then trying to get them to kind of understand where they were falling short, and in what ways they could improve that. I think somebody else had asked a question about kind of differences between corrections agencies that do food service on their own versus ones that contract it out. DC is a good example. I think Aramark, and Aramark is the largest company in this space. for those of you in Philadelphia, feel free to pick it outside their Death Star headquarters on the riverfront. There's a couple other, Aramark's really the only one that works both inside jails and prisons and in lots of other settings, right? Sports arenas, military bases, colleges, schools. Aramark is all over the place. It makes them kind of uniquely vulnerable, I think, to some reputational pressure around this issue. There's a couple other smaller ones. Trinity is probably the next largest one. Trinity Food Service, Summit. There's a couple others, smaller ones. I think our data says, somebody had said in the chat that, well, these are public contracts. Yes, and they are, but if you go looking and if you wanted to make a comprehensive survey of what jails and prisons had contracted out food service, some of us have been working on that, and it's not an easy thing to do. They don't really advertise this. They'll say we're in a dozen states. So, as far as we can tell, as best as anybody can tell, probably food service is contracted out in about a third of the state departments are correct out there, maybe a little more. In jails, a little bit higher prevalence. I think it's pretty hard to tell with 3,500 plus jails spread across this country. And that's not even mentioning the youth detention facilities, tribal facilities, immigration facilities, and all the other things that make up various aspects of our carceral system. But we know there's a few companies that kind of dominate this space for the ones that are contracted. And I do think the idea of private companies in this space is problematic. They will say that they just do what they're contracted to do. The state agencies or the county jails write the contract. They put it out to bid, and the company's just being responsive to what was written in the contract, what was asked for, essentially. I think that's true up to a point. I think having a private contractor in those spaces tends to inhibit progress or inhibit change. It can be a barrier to change. And in the places where we've seen change, I think they tend to be places without private contracts in place. And there is good work. There are positive changes going on. Harvest of the Month is a great example. In Oregon, there's an organization called Nutrition Inside that's delivering excess farmers market produce directly to Department of Corrections facilities. Maine is, there's a lot of folks will talk about Maine. I think they're probably leading in some ways around this issue on a state level. They're doing some things right. They're growing food on site in prisons, and that doesn't really exist much. Growing it and serving it to the general population, not in the officer's dining room, not sending it out to market. They're growing it and serving it. They're baking bread from scratch. And there are these pockets of positive change going on around the country. There are jails where, for instance, New York and Chicago, where there's been enabling policy around values-based procurement, purchasing local, purchasing fresh, purchasing from small vendors locally. And that policy has been put in place, which then allows, I think, community organizations to try to partner with jails and prisons and say, hey, we can help you implement this policy that you're subject to, like every state agency. In those places, it's kind of across the board policy around public procurement. And so I think in those places where you have policy in place that enables progress, we're starting to see community organizations who, often come from kind of the school food space or other spaces where we I think have made progress over the last 10 or 15 years in healthier eating, going to work with these facilities to improve things.
Oh, thank you so much. I'm trying to be mindful of time, and we do have some great questions coming in. But I have one more that I'd love to get y'all's insight on before I turn to the kind of group Q&A. You know, you've talked a lot about how food access and food quality and all of these different things are really not uniform. Like, we can't talk about food in prison as this monolith, but rather it changes a lot. And so, one question that I had was if y'all could tell us a little bit about anything related to how men's and women's facilities might treat nutrition and food differently. You know, we know that health and nutrition is related to all kinds of other aspects of your life and your identities and all of these things. But has there been any attention to that particular issue? And are there any differences when you look kind of broadly at women's facilities and men's facilities around food?
Yeah. Speaking from the women's perspective, a lot of the times there is this emphasis on calorie count for carceral food, and carceral count is pretty general, whether it be for men or for women, male or female. But we know that there are different demands for women, you know, typically less than what, you know, a male would need, but even, you know, different changes, preferences, timing of the month kind of things, for lack of a better term, for women, right? Like, I think that there have been many times where women are just like gravitating towards like these like very high starchy, processed foods, sweet, sugary foods, because there are no other alternatives to help try and satisfy, you know, that sweet craving. When I was speaking to a lot of women who were pregnant at the time, you know, I would hear lots of complaints about the lack of healthy snacks for them. Oftentimes they would get an extra milk and that would count as a snack, but yet they were hungry, going to bed at night, super hungry. You know, the gaps between feeding times, like Daniel had mentioned, it's written in policy really that the institution cannot go more than 14 hours between meals. But my goodness, if that is the maximum amount of time, like even for me, like 5 hours between meals, I'm hangry, right? Like depending on what it is, especially if it's these like very like white starchy foods, those kind of just run out of you pretty quick. Um, Additionally, for canteen options, there seem to be more privileges for women. So I saw there was a comment in the chat, you know, this idea around making pruno. For the women, we were allowed to have things that had sugar in them. Whereas for the men, there were restrictions where men couldn't get things with added sugar. A lot of times things were sold as sugar-free, but there was no one within DOC that could share as to why women were allowed certain items on canteen, but men were not. Because the issue of making pruno or, you know, in-house made alcohol is and I mean, it could happen anywhere, right? Like, I don't think one population makes it necessarily more than another. And so for me, like, there was no justification as to why it was the way that it was. But yeah.
Yeah, I think Heile is a better place to speak to those issues, but I think what we do know, we do tend to see some differences when it comes to state prisons, where men and women are segregated in different facilities. In jails, which often house both men and women, what we tend to see are institutional menus that are the same for men and women, and that feed the same calories, the same food. And what we often see is men losing weight and women gaining weight in jail facilities, especially. And I think there's very little differentiation. I mean, we see the same on other demographics, whether it's, you know, a 20-year-old who's on the yard every day exercising versus someone who's 65 and sedentary. Those two populations, male or female, have very different requirements for nutrition, and most facilities don't differentiate among them. So I think, you know, from a gender nutrition standpoint, we're not doing anybody any favors in the way that we tend to feed people the same. And yeah, I've had conversations with women who have spent time in women's facilities. It gave me kind of the same impression, I think, that there may have been more available, that they may have had a little different options. And I do think it is, it does seem to be kind of based on that issue around wine. I mean, I'll just say people made wine in every facility I was at with whatever they could make it with. And prison and jail administrators use that as that security excuse a lot when it comes to fresh fruits and fresh fruits, and especially fresh fruits. And people will make wine with potatoes. I mean, they'll make wine with anything that you can make wine out of. And it's, I think in DC especially, it's been a barrier to progress on serving people fresher food. There are ways, I think, to minimally process fruits, especially, that allow less of that to go on. But if, security always wants to build the wall higher, no fruit would be best from their standpoint. And I think we have to balance that against other imperatives like people's health and nutrition. And
Yeah. I'm going to turn to a couple of questions. This one's kind of related to these dietary needs or kind of differences on what people might need in terms of food access. But we've got a question. What is it like to have dietary restrictions, whether these come from allergies, religious restrictions? I'm a vegetarian, so I'm wondering about that, in the carceral space.
Yeah, so depending on your dietary restriction, you may or may not get different types of meals. So, for example, if you're a vegetarian, you will see more beans than the general population. You will see eggs if they serve you whole eggs. Um, if you subscribe to a kosher diet, here in California, they outsource their kosher meals just to ensure that everything is, packaged accordingly and no contamination, etc. It is also known, or this is like a popular opinion, is that the kosher meals are better because they have like smaller pastries, or it seems like they get an extra piece of fruit. But I think, again, it goes back to the fact that those meals are recognizable. You can tell what a pastry is because it actually looks like a pastry, or like the meat actually looks like a piece of, or whatever it might be inside of that kosher meal. Now, if you are someone who experiences diabetes and you have that type of restriction in terms of your carbohydrates, there is unfortunately not much that you can do for yourself. Unfortunately, the guidance is to just eat around the high starchy foods, which is unfortunately a very large portion of that diet. I just wrapped some recent visits last month where I was speaking to an incarcerated individual who was complaining about the fact that there was nothing he could eat on his tray as a diabetic. And that is not just one person's experience. Many people who are incarcerated face that. And when they can't eat what's on their tray, just out of hunger, out of, wanting to feel fulfilled and wanting to eat a good meal with their remaining options, more likely than not, they're resorting to those same canteen items that they also know they should not be eating, but they would rather eat something that's palatable, right? So we just have this revolving door of issues that are going on that is really just designed this way. I subscribe to a vegetarian diet. I will be honest, I'll confess, so that I can get more protein, because in my mind, I felt like I wasn't getting enough protein as someone who was, in a fire camp program. So I was fighting wildland fires. So that was my loophole. And unfortunately, that was just a game that we had to play in order to get what we felt was healthy for us at the time.
Yeah, I think what we know is there's a very large percentage of people in jails and prisons that come in with chronic diet-related disease. And if they didn't have it when they got there, a good number of them are going to develop those things while they're there. Um, Other chronic diseases too, not just diet-related ones, but especially diabetes, high blood pressure, obesity, as well as heart disease, as well as other issues too. And so there are, in theory, every jail and prison has some sort of dietary provision made for people with those diseases. In reality, I think, there's a whole movement going on out here in the world around food as medicine, around medically tailored meals and produce prescriptions and um, all of these things, all of these kinds of programs out here in the world wouldn't recognize what's served inside jails and prisons as parts of those medical diets, quote unquote, as legitimate attempts to meet people's dietary needs who have those kinds of conditions. They would be laughed out of the room. They're generally some variation of the unhealthy diets that are served in the first place. So you just get more of one thing and something else is removed from your tray. Um, the the most popular diet, I think, popular is a funny word, but renal diets for people who had issues with kidney function were the most sought after diet in the prisons that I was incarcerated. They had the most recognizable food on them, along with, as Hyla said, the kosher meals. But people would pay a lot of money to anybody who was on a renal diet to give up the food that they were served. It wasn't great, but it was better than the food that was served to the general population. People would pay a lot of money to the folks who worked on the kitchen line if they could smuggle out any of the items from the renal diet line. Um, and that is a sad state of affairs. There is a very large contraband food business that goes on in jails and prisons, both, especially prisons. There's more, as some folks have mentioned in the chat, some kinds of, growing programs around fruits and vegetables that creates a black market. Food sold out the side door of the kitchen creates a black market. I tried to make sure I lived with folks who worked in the kitchen in whatever housing unit, whatever facility I was in, because I knew that they would come back to the housing unit with stuff for sale. And that creation of that black market, because the institutional food service is so bad, is creating a whole set of disincentives, for lack of a better word, a whole set um, of problems just as a result of crummy institutional food service. And folks, the other thing I want to kind of mention here is, sure, all those kind of medical conditions have diets that tend to be associated with them, even if they're kind of laughable. What we really don't also do, though, is take care of people who we know have this very high incidence of addiction and mental health issues, whose addiction and mental health issues could be probably addressed and improved through nutritional interventions. I think there's a lot of new research coming out around that. But, from what I saw, at least from my experience, from everything I know, diabetes is a big problem in jails and prisons, but addiction and mental health issues are much bigger problems. And the kinds of diets we're actually feeding people tend to perpetuate those issues. We have some research now on the kind of health effects that ultra processed diets tend to provoke. And we're not helping anybody who has substance use issues, who has mental health issues with the way we're feeding them.
Yeah, thank y'all so much. I feel like we've answered kind of indirectly a few of these questions, but I want to come back, and I know that we're getting towards the end of our time, but we have a question. To what extent does a purely punitive attitude toward people in the carceral system affect the willingness of facilities to change their approach around food and nutrition? And we haven't talked about food as punishment directly, but maybe y'all could speak on just this as the attitude, whether we're talking about the general population, or I think, you could even look more specifically at food when you're in the hole or in like other spaces of the prison that kind of face a specific set of kind of food as punishment type of approach.
Yeah, I think simply put, if folks have this very like punitive attitude regarding the carceral system, there is very little to no motivation to improve the food, right? I think that it becomes then an excuse, a reason to keep things very minimal. It leaves things very bland and white on a tray, very little care. It's just more about output, right? Making sure that everything is on the clock, that everything is logged, that nothing can come back to them. However, I do think with the attitudes that we've seen coming from Maine, like Maine's model of corrections or California's model, as we're trying to get into a more rehabilitative approach to things, we are finding some folks on the ground who want to think outside of the box, right? They want to create these large garden programs, for example, in Maine, where they're actually introducing the food that they grow into the food system that feeds those who are within their care, right? I kind of say that loosely when it comes to carceral systems. But I think that it really does come down to the attitude and the cultural change that happens from the inside and then out. I think that there has to be some of that coming from the inside. I know I was talking a lot about like top-down approaches, but really cultural shifts come from the inside. It comes from the voices of people who are most impacted and having that echo out and amplify out into the community. And then having spaces like this, right? So that we can continue to push the work forward and show its importance to folks who may not otherwise be exposed to this kind of topic.
Yeah, that's well said. I think food as punishment is an interesting issue. There tend to be very few standards, and has not been much by way of court cases around the use of food as punishment. I think every jail and prison will tell you that they don't use food as punishment. And I think anybody who's been incarcerated has seen it used as punishment informally. Even if that's just somebody's, for an infraction and they're on cell lock and they don't get let out for dinner. And they can bang on their door all they want. And there's that kind of indifference, like file a grievance, go ahead, I've seen it numerous times. I think most facilities have gone away from what was kind of the classic food as punishment, which was a thing called neutral loaf in most places, where the kitchen just kind of threw everything into a big trash can and stirred it up and threw it in the oven and served it as like a loaf of a brick. Most places have stopped doing that, not all of them. But I think I saw something kind of recently that troubled me in Virginia, which was the use of food as an incentive. The creation of housing units or facilities with access to better food based on good behavior, which is this weird inversion of food as punishment, right? As if people don't deserve decent food. Like the salad bar is only for the people who act right. And then somebody gets to decide whether or not you're eating. And that I think is a little bit troubling. I think Virginia is touting this kind of Virginia model as providing these incentives and holding people accountable. But it kind of negates the idea that everybody deserves good food. Everybody deserves decent meals, adequate nutrition. I do think there's this kind of popular idea out there that, well, people who complain about prison food, like you do the time, you do the crime, people want steak and lobster, like, um, you know, people out here have to pay for their food, so why should people inside eat better than people out here in the free world? That kind of thing. I don't, I've never heard anybody inside or outside argue that um, steak and lobster is what's being asked for or suggested. But I don't think we have any kind of um, social agreement around what constitutes good enough, like what's adequate food for someone who's incarcerated. And, I think to my mind, there's this idea that if you wouldn't serve it to your family, why would you serve it to someone else's family? And that's, at least one standard. If you wouldn't serve it to your kids, if you wouldn't eat it yourself, why are you serving it or suggesting that it be served to somebody else? The punishment is supposed to be the incarceration, not making the conditions of confinement as bad as possible.
Yeah. Thank you. We are kind of getting towards the end of wrapping up here, and I'm going to put both of the links that I shared at the beginning to direct folks to y'all's organization's kind of web pages. But if I could get both of y'all to speak to, what can the people on this call, what can the general public do that might help support changing these conditions? What could we do here? Our region's mostly mid-Atlantic Northeast. But like what steps could we be taking to try and push this agenda and this kind of issue to create some kind of change in the way that this is happening?
I think a very easy first step, if this is a new topic for anyone, is just to bring it up in discussion, right? Like for those who are interested in food or are maybe already sitting on a local food policy council, just see, are we talking about folks who are inside of carceral spaces and folks who are eating inside of these carceral spaces? And really just see where those conversations go, right? It may not even be necessarily about you leading that discussion, but maybe there's a lot to be learned about the response, even in just bringing that topic up and engaging folks, from there. And also just continue to stay curious, right? Like there are so many times where we talk to stakeholders and drawing those lines from those who are inside of carceral facilities back out to the community. Most people who are currently incarcerated are coming home, right? They will be our neighbors. They will be our friends, our, fellow churchgoers, maybe even an in-law. And we would want those folks who are returning back into society to be folks who are ready to, just reintegrate, not have to worry about their health. So just really staying curious and just being mindful and empathetic of the situations that are happening inside of these carceral settings would help advance the work.
Yeah, I think food policy councils is a great suggestion. I think a lot of localities are starting to have, that's becoming a more common phenomenon. I'll be honest, DC's food policy council has been engaged on this issue, but it's not even like on their standing agenda among their working groups. There's a lot of food issues in any city like DC, in any big city. Big questions around SNAP, around WIC, around seniors, around a lot of folks with food insecurity. I think the other thing that is worth thinking about is the increasing prevalence of jail and prison oversight organizations across a number of states in the last 5 to 10 years. just in the last couple years, Maryland and Virginia have created new oversight or ombudsman organizations, or they can look different in different states. But there are oversight organizations. Illinois, New York, Pennsylvania all have oversight organizations. And all of those tend to pay attention to food because it tends to come up a lot in people's critiques and complaints and grievances. Health does too. And obviously those two things are deeply related. So I think those are places where folks can often get involved, even volunteering at some of those, just to even open letters or answer or respond to correspondence. I would encourage folks to, if they're not visiting prisoner jail facilities through something like PD Green, to look for things like the Frederick Douglass Project, that facilitate and organize visits, especially I think to jails. And I think they're active in some of the places where PD Green is also active. Started by a colleague here at Georgetown University. And I think then, yeah, what I said around this, just paying attention to this issue, I think we are starting to all pay more attention to the impact of food and nutrition on our health. And I think that's something that we can just ensure that jails and prisons are not forgotten in that conversation. Schools, grade schools feed something like 30 million kids a day. That's a big number. There's no larger food service operation in this country than school food. But jails and prisons feed a couple million people a day. And that is a big number that tends to have outsized public health effects on all of us, while people are incarcerated, but also while they come home.
Yeah, thank y'all so much. I feel like this conversation really gave some texture to this issue. Daniel, you actually did this for me, but mentioned that this is part of a kind of week-long Going Green event on the topic of food. And I wanted tonight to really focus on food and food insecurity and nutrition on the inside. But I am going to put a link here to our other Going Green events, which are going to take a kind of different angle. We've talked a lot about food insecurity and food deserts and the way that our inside facility and outside in the free world type of systems are actually not these separate things. We have really stark food access issues across the board. And, Heile, you mentioned that most people who are currently incarcerated are going to get out. They're going to go through reentry. They're going to be part of communities. And given what we know about the way that the kind of compounding issues related to going through the carceral system, they face a lot of barriers around food access once they get out. So all of these health impacts that we're talking about on the inside, it's not like they go away as soon as you walk out of those gates. They actually continue, and the issues kind of become different, but also the same. And so our Going Green Week is going to touch on some of these issues related to what does food insecurity and food justice look like for people who are going through and have experienced reentry. I encourage folks to take a look at that. There's a restaurant guide for second chance employers in there that allows you to support businesses that are allowing people to have the opportunity to get, good paying jobs once they are on the outside and kind of reintegrating back into their communities. And so I'm going to kind of close this out here. My timing is mostly good, I think. So I appreciate all of y'all's insights and really engaged questions. This chat feature is a new one for our webinars, and I think that there's a lot of great stuff in there being shared by folks who have direct experience in these systems or are working on these issues in their own ways. So I appreciate all of the stuff that y'all put in there, and really appreciated y'all's engagement as audience members. And then another kind of final thank you to Heile and Daniel. I really appreciate y'all taking the time to highlight the work that's going on food justice and nutrition. I think that you've given us a lot of stuff to think about, and that, kind of to y'all's point there at the end, talking about this is the first step, and that is something that all of us can do regardless of where we are located and kind of what power we feel like we have. We do have the power to change the narrative and make sure that this is an issue that's on the forefront of conversations around food. Um, I'm gonna kind of close with a plug for kind of all three of our organizations, but the Coalition for Carceral Nutrition, Impact Justice, and the PD Green program are all made possible through generous donations. The pages that I shared for the two organizations of our panelists will have information about donating there. The PD Green website has places to donate, but also I want to highlight the importance of sharing things on social media, whether that's through the PD Green program social media pages or the Coalition for Carceral Nutrition or Impact Justice. Having that discussion happening on social media helps amplify these issues in the virtual space. And then finally, you all will receive a survey from tonight's webinar. We really value y'all's insights, feedback, questions, comments. We use these to determine next topics for our justice education series, and we really do take that feedback to heart. You'll also get an email with that later in case you missed it in the chat. And then, yeah, just another thank you to our panelists, and thanks everyone, and have a great rest of y'all's night.
Thanks
Bye.
very much for doing this. Appreciate you.
And thanks, everyone.
And thanks everybody for being here.